Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine chiropractor. I'm here with Ian. We already did a couple videos explaining what brought Ian here, what a brain-based neurology and posture exam is like, and now you're going to get a glimpse of part of his treatment with regards to brain-based neurology and posture. We've already determined from our examination that Ian's dominant eye is which eye?
My right.
Your right eye. And we already know that it's not okay to have a dominant eye because...
You use both of them and none of them should be dominant.
Exactly. So this is very true. We want to activate the eye that is kind of taking things a little bit on an easy side. So we're going to cover Ian's right eye, the dominant eye, with an eye patch, and then have him do certain exercises on the board. This has to do with brain-based neurology and posture exercises that I keep referring to. So we're going to cover this. Go ahead and become a pirate here for a second. You're okay? Maddie, can you step over here and get a shot of Ian? So the instruction here is, we've noticed that Ian's left eye does not like staying on the inside close to the nose. So what we're going to do is do exactly what it doesn't want to do. So he's going to be standing here with a nice slightly lifted spine, arms next to you. And in order to really bring the focus of the brain into the exercise, I'm going to ask Ian to use whichever hand works better for you, probably the right hand. You're going to be touching the center of the board. In your head, you're going to say 12, 1, 2, 3, all the way to 6, and then backwards. So that's essentially that. We put the patient in the proper posture to really get the brain-body connection going, even though he may not be able to hold this posture at this moment for a long time. And bring to the attention of the brain, because now if it's thinking 12-1, it's going to pay closer attention to the task. We're covering the dominant eye and exercising the movement that the non-dominant eye prefers not to do. So Ian, like I said, you're going to be touching this. Do you reach this comfortably? Right? So you're going to go in your head 12, 1, 2, 3, 4, 5, 6. Go ahead and give us one shot. And in your head, you're counting the twos, right? So your head is not going to be tilting up and down. Your head's going to be looking at this spot while the eye is doing the movement. So that way it is forced, being attended to, constantly making sure that the eye is moving towards the nose. As we progress through this exercise, we're going to step a little more to the left, facing the board, face the board. So in more advanced, not more advanced, but as Ian goes through this exercise more often, he's going to step a little bit. So the eye is forced to go farther to the right while the head is staying straight. You can become a non-pirate at this point if you want. So we're going to go ahead and do the exercise once we turn off the video. But this is a glimpse of what some of the exercises that Ian is going to have to do for what is week 4 Ian looks like. By activating the weak part of his brain through these exercises, we make him stronger, so both the left and the right eye are able to give all the input from the surrounding areas to the brain, so the brain can have all the necessary information to determine what proper posture and balance is. The more we give the brain what it needs to determine proper posture, the more balance you have, the less opportunities you have to injure or re-injure yourself and have chronic lower back conditions, headaches, whatever the case may be. This is how you get to the root cause of the problem. Instead of working on just Ian's shoulder or just Ian's wrist, which is what initially brought you here, we're working on those parts because of the fact that this condition you said was 3 years old.
3 years old.
That's a lot of time for his body to shift the posture and gauge the posture. So it's easy for him to not necessarily injure the shoulder. This was from shot put and discus exercise, but it's much easier for Ian to have lower back issues, which you do, have issues with the neck, which you do. And so if we bring him closer to the balanced state, there is less opportunities for more of these issues to show up. Thanks for watching, and don't hesitate to contact me if you have any questions. Thanks, Ian. Thanks,
No
everyone.
problem.